Hello, everyone. I'm Dr. Rohan, your Marrow Surgery faculty, and it's an absolute honor to be introducing Dr. Kareem, who secured a score of 234 in the recently conducted FMG exam. This was his first attempt. He's a graduate from Philippines, and he used the Marrow QBank effectively, and that would be the main source of discussion today regarding how to use the QBank effectively so that it can help in your FMG preparation. Heartiest congratulations, Dr. Kareem.
And thank you, sir. How are you, sir? Sir,
I'm good. How are you doing? How does it feel to crack the exam in the first attempt?
it feels very, very good, sir. After like a 6 months of hard work, it feels very, very now happy, sir. You are my favorite teacher in the Marrow, sir.
Thank you. Thank you very much. And you were
Yes,
using
sir.
the QBank. So can you tell
Yes, sir.
us since when did you start using the QBank and what were the tips and tricks
Mm,
which you utilized
yes,
in
sir.
QBank which helped you to get this score?
Sure, sir. Sir, I started using Cuband, I think, around February, sir. February, and I
Okay.
and I used and I use specifically the custom module with the tag of need with the tag of recent need and the FMGE question and the if you want you can add the aims question, sir. And then I integrated the previous year questions and the topic to my uh, to my uh, notes doc. This was my main strategy though. It was like simple and it was and it was not like so and it was not like so complicated though. First, we need to stick to the one note though. Whatever should be the shows. Will it be like marrow prep or like mixed though? And then we should we should concise the notes though. We should concise the note and then we have to do the multiple revision with the concise note. We should not do the uh, revision with the main notes though. That is the mistake though. Like most of us do. We should concise the note and then we should do the revision of the concise note. Uh,
Fair
uh,
enough.
this was my
So
strategy though.
I think so. Very simple strategy. What he's trying to say
Yes, sir.
is that don't overcomplicate things.
Yes, sir.
First, make your notes, then try to
Yes, sir.
concise them by
Concise
underlining them
and
and just
then
doing
yes,
focus
sir.
thing.
And then annotate the notes with the previous year questions and topics though. Simple though.
Correct.
It is not
So
so complicated.
and then just keep on revising those
Yes,
notes
sir.
and the
Yes, sir.
previous year questions, which he did
Yes, sir.
using custom modules in the Marrow
Yes,
QBank.
yes, sir.
Perfect. Perfect. So you were solving the NEET PG QBank or the FMG QBank?
Both, sir. Both.
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 So this time
I,
the exam was quite tricky. It was challenging. The
yes, sir.
pass percentage has also fallen down to 10%.
Yes, sir.
So do you think that by doing questions of slightly higher difficulty, it helped you in this exam?
Yes, sir. Doing the question with like higher difficulty give me the extra edge, edge though, compared to other batchmates. Sir, one main mistake we do is we are in the like this FOMO, though, like fear of missing out. So how we go to the multiple like sources though. This is the main like blender though. Like most of the aspirants do though.
Absolutely.
I feel.
So I think so. Two things which you've very clearly highlighted: get rid of the FOMO, fear,
Yes, sir.
and the second thing is don't overcomplicate things. If you
Mm.
can do that, and if you can do your effective revision, then passing the
Yes, sir.
exam becomes very
This is it.
easy. And
Very very easy. Do it.
one more thing which she's highlighted is that in practice, always practice questions of higher difficulty so that
Mm.
the actual exam feels easier to you rather
Yes,
than
sir.
doing less difficulty questions in practice and then struggling in the exam. So how frequently were you appearing for grand tests, Dr. Kareem?
Uh, I used to give each grand test for like 3 weeks though. uh, one for every 3 weeks, and then the most important is to review the grand test. That's the main purpose of the grand test. We need to find the where we are like lacking which subject, and then we have to like work on it, and then we can slowly like improve in this score. Same goes for the need PG.
That's correct. So, which were your strongest subjects and which were your weakest subjects when you were taking grad tests?
My strongest subject was like medicine, medicine, I
That's
think,
correct.
and my weakest subject was ortho, I feel.
How did you deal with these weak subjects? How did you deal with ortho and the other weak subjects? How did you make them stronger
Uh,
for the exam?
we have to do last revision in the at least last 15 days. We have to do like whole like subject revision with the concise notes in the last at least in the last 15 days.
Would you recommend somebody doing just revision videos and the notes for preparation for FMG?
FMG, yes, doc. Yes, doc. We have to do like multiple revision, doc. At least
Correct.
four, doc. At least four with the like concept based, doc. And then with the previous year, so we integrated with the previous year topic, doc. That's the main.
Correct. And
I
were
was
you
like
using
concentrated.
pearls as well?
Yes, doc. Very useful, doc. It was like a concise and very high, doc. For also. It was also like very useful, doc.
Any other tips which you would like to share, Dr. Kareem? It
Oh,
was
sure.
very good talking to you. Three key takeaways are not to overcomplicate, stick to
Yes,
one
sir.
sword, keep on revising,
You won't
and
be like so much.
do questions of higher difficulty during practice. These are four
Nice.
things which I can gather from his preparation, which have
Yes,
been,
sir.
I mean, very simple and, like we say, kiss, keep it simple
Yes, sir.
and stupid.
Simple
That is
and
the kind of
like,
preparation which
yes,
you
sir.
need to have.
We need to have this self confidence, no? Like, like we can track any exam, like FMG, NEET PG, ionized status. And the second is the consistency, though. Consistency is the key, though. We need to study at least 10 hours, though. 10 hours, I feel, is the like at least minimum 10 hours. We hit the bread. We can also maintain our lifestyle also.
The
The,
proper
the,
work-life balance
the
can be
most
there. It is not only
important is
studies which is there.
sorry,
You
yes,
strike a good
like
balance between studies.
like we have to like balance yes, like mental health is also like important, like uh, preparation factors. That's the like key, like we have to like balance our both academic and the non-academic also. That, and
Perfect.
that's the like second point. Third point is the uh, uh, third point is the we have to like concise the notes. We have to concise the notes like first is the we can read the main notes, then we have to like concise it for the uh, revision. Then also we have to concise it for this second revision, like a pyramid. We have to focus mainly on the high yield at the end of, like only the high yield at the end of. And the fourth is the like we need to give more time to the major subjects, like surgery, OB, and then PSM, and then like pharmacology. We have to focus also on the mark building subjects. We should not leave a single subject. In our exam, the the forensic medicine had 15 questions. Like we can't predict the questions from the each subject. It varies from the year to year. So we have to like cover the whole 19 subject also. That's the that's the main point.
So don't leave any subject, but focus on the
Yes,
major
sir.
subject.
Yes, sir. Focus is on the major, but we should not leave a single subject also. That's the main point, doc. Because we can't predict the examiner, doc. Like which subject can have the high question, doc. In our exam, doc, the first part was for me it was easy, doc. PSM had like tough question, doc. PSM was like slightly in the tougher side, doc. But the pharmacology question and the anatomy question was like a case based, doc. Case and clinically oriented based. Question was like integrated, doc. Like for surgery plus anatomy, doc. Question was both integrated, doc.
Perfect. So I think so. Great tips by Dr. Kareem. Dr. Kareem, thank you for taking out time and
Yeah,
sharing these
thank
tips
you.
with us.
Yeah.
I think so. You have a great preparation strategy, and
Yes, sir.
I'm sure you're going to implement it in NEET PG as well. And
Oh,
I'm
yes, sir.
sure you'll get a great rank there also.
I need to say like few points, doc.
Yes, yes, please,
Like a
please.
summary, doc. First is this the health, belief, and confidence, and then we need to balance our lifestyle, and then academic and non-academic, and then we need to stick to like one source, and then we have to integrate the previous year question and the topics to the notes, and then fifth is the we have to concise the note with every revision, and then is the multiple revision is also the key. Main key is the multiple revision. We have to do at least hold up, and the last revision should be in the at least last 15 days. Last 15 days is the main important phase of our whole preparation, doc. Whole 6 months or 7 months, doc. Last 15 days is like a marathon, doc. We have to like go fast, and we have to focus on the most hail topic and the most forgettable things for you, doc. For me, like factual questions, we have to focus on the high like forgettable things, doc. We have to have a sleep, doc. Like adequate sleep for the like last 3 days at least, though. Like before the exam, though. Like sleep is the main, though, and then is the time management, though. uh, this year the first part for me was like uh, time taking, so we have to give the grand test so that he can find the which are your you your weak subjects, and like which are your light strong subject, and then we have to give the grant test every 1 month, and then we have to review the like grant test. That's the most uh, important.
Yes.
Each subject we have to allocate the time, down. Like for like major subject, we need to give more time, down comparatively to the like minor subject, and that's the main point for me,
Thank you.
from my
Thank you.
side.
I think so. Dr. Kareem, you've summarized it beautifully. And I think so. People, please listen to him patiently. He's taken out a lot of time to share these thoughts, but I feel all of them are very relevant. Please
This is a
listen to him. And I'm sure
preparation,
if you listen to him, you will do extremely well in your
uh,
exam. Thank you very much,
dot,
Dr. Kareem.
the last is the we have to believe in our preparation,
Yes.
like we can do this, like we can like crack this exam. Thank you so much, doc,
Yes. Thank you.
for
Thank
like
you. Thank you, Dr.